So, what do you know about birth control? Well, whatever you might know, I'm here to answer the common questions that you guys have. First question, what exactly is birth control? Well, birth control is any method used to prevent pregnancy. I mean, that's simple enough, right? Well, what are the different types of birth control? Well, there are many different types. There's condoms, there's the patch, there's NuvaRings, there's birth control pills, and there's IUDs. Well, now that we know the different types of birth control, we're going to figure out what each one does. This is a condom. Condom is a form of birth control that is placed on an erect penis. This is the erect penis. So, you unwrap the condom, pinch the tip, place it on the penis, and roll it all the way down. Be careful, try not to tear or rip the condom, that'll render it useless. Now once you place the condom on the penis, you can go ahead and have fun. But remember, condoms are only 98% effective if used perfectly. However, it's only about 82% if not used perfectly. 18 out of 100 people who use a condom as their only form of birth control will get pregnant each year. Alright, so next up we have the birth control pill. The birth control pill. Oh, okay, thanks. That's too many. Alright, no more. Stop it. Get away. Okay. Ow. No. Okay, whatever. Moving on. The birth control pill is a prescription-based oral supplement that should be taken every day. The birth control pill releases high levels of estrogen and progestin to stop the ovaries from producing an egg. The progestin also helps make cervical mucus that stops the sperm from coming through. Now, the birth control pill is very effective. It is usually more effective if it's taken the same time every day. Less than 1 out of 100 women will get pregnant each year if they take the pill correctly. The birth control pill can cost anywhere from $0 to $50. Coming up third, we have an IUD, or an intrauterine device. This little guy is a small T-shaped object made out of flexible plastic, and it's inserted into a woman's uterus. There are two different types of IUDs. There's hormonal IUDs and copper IUDs. Copper IUDs use copper wire to prevent the sperm from making its way into the egg. Now these guys can last you up to 12 years. Hormonal IUDs work in a similar way to birth control pills. They release small amounts of progestin and sperm cannot get to the egg. IUDs are very effective. Less than 1 out of 100 women will get pregnant each year if they use an IUD. Last up, we got the vaginal ring. The vaginal ring is a small, flexible ring a woman inserts into her vagina once a month to prevent pregnancy. It's left in place for 3 weeks and then taken out the last remaining week with each month. The vaginal ring is commonly called by its brand name, the NuvaRing. Like similar methods of birth control, the NuvaRing releases estrogen and progestin. It keeps the egg from leaving the ovaries. It also helps create thick cervical mucus. The NuvaRing is very effective. It works best when kept in for 3 weeks and taken out the last week and replaced with a new one. In conclusion, these forms of birth control are very effective if used properly. However, there is always a present risk of pregnancy when using birth control. The only surefire way of avoiding pregnancy is not having sex at all. Abstinence is 100% effective and there's nothing wrong with it. Well, let's say your birth control doesn't work or you have a contraceptive accident. Well, there's always the morning after pill you can take. The morning after pill, or emergency contraceptive, is a way to prevent pregnancy after unprotected sex. If you did use birth control but it wasn't effective and you end up getting pregnant, there are other options. If you don't wish to carry out pregnancy, abortion is always an option. Abortion is the termination of a pregnancy, and there are 2 different kinds of abortions. There's the abortion pill or an in-clinic abortion. The abortion pill works by using 2 different medicines to end a pregnancy, mifepristone and miroprostol. The abortion pill is safe and effective, and it can be used up to 70 days or 10 weeks after a woman's last missed period. An in-clinic abortion is a medical procedure to terminate a pregnancy. It can be done up to 10 weeks after a woman's last period. There are 2 different types of in-clinic abortions. There's aspiration and dilation and evacuation. Aspiration is more common. It's also called vacuum aspiration. It's usually done up to 16 weeks after a woman's last period. Dilation and evacuation is usually done after 16 weeks. Both procedures are very safe and effective. Contrary to what you might think, in the state of California, parental consent is not needed for an abortion. The clinic you visit cannot release any information about the treatment you have received. However, abortions do cost quite a bit of money. On average, the abortion pill can cost up to $800 and an in-clinic abortion up to $1,500. Some medical insurances cover abortion, But if you're covered under your parents' insurance, it will appear on their records, and if you don't want your parents to find out you had an abortion, there's going to be a few issues. At Planned Parenthood, for example, you have the option to apply for medical insurance for yourself, which will result in low-cost treatment. Wanting to or getting an abortion is not something you should be embarrassed or ashamed about. Abortions are very common. 3 out of 10 women in the US have had an abortion by the time they are 45. Getting an abortion can be hard for a lot of people, and it can be an uncomfortable subject to bring up with your parents or your partner. Well, all in all, just remember to be safe when you have sex. Or you could avoid all this by just going home and playing with yourself. Have fun!